A World Health Organization-led team studying the origins of COVID-19 have turned their attention to the case of a mystery Italian woman. The 25-year-old visited a Milan hospital complaining of a sore throat and skin lesions in November 2019, a month before COVID-19 would be identified in the Chinese city of Wuhan. Research published in January this year found that a skin sample left by the woman yielded traces of the coronavirus when it was tested more than 6 months later. Scientists say the woman's case suggests that the virus was circulating in China and elsewhere long before the first cluster exploded at Wuhan's Huanan seafood market in December 2019, and further study of her case could help to determine just how long. The only problem is that no one knows the woman's identity. The Wall Street Journal reported that the facilities that oversaw her case, Milan's Policlinico Hospital and the University of Milan, say they do not have her details, while Raffaella Gianotti, the dermatologist who treated her, died in March just days before the WHO-led team requested more research into the patient. The team has recommended searching for possible COVID-19 cases in other countries that predate the first confirmed Wuhan case. Researchers say examining earlier suspected cases could help firm up a timeline of the early spread of the virus. To do this, the team has asked blood banks in several countries to test samples from late 2019 for the presence of coronavirus antibodies. Several studies have suggested that individuals were infected with COVID-19 before the first cases of the virus were reported in their areas, but the Italian woman's case remains one of the most intriguing. A blood test taken from the woman in June 2020 tested positive for coronavirus antibodies. Months earlier, on November 10, 2019, a skin sample was taken from the woman by Dr. Gianotti. When the pandemic hit Italy in early 2020, Dr. Gianotti looked back through archived skin samples searching for any trace of COVID-19, the Wall Street Journal reported. He conducted 2 tests on the woman's skin sample, both of which found the spike protein and protein shell, but the sample was too degraded to conduct a crucial 3rd test. This test would have allowed Dr. Gianotti to genetically sequence the virus, providing a more definitive confirmation that the woman had indeed had COVID-19 and potentially allowing researchers to compare it with cases from China. I was disappointed for only one thing: that we cannot confirm it with another, 3rd technique, Massimo Barbaras, a co-author on Dr. Gianotti's research, told the Wall Street Journal. Dr. Barbaras pointed out that, while the woman's blood taken in mid-2020 tested positive for antibodies, COVID-19 had engulfed northern Italy by that time, creating the possibility that she might have been exposed to an asymptomatic infection sometime after her November illness. While the woman's identity remains a mystery, Dr. Barbaras said he believes enthusiasm for figuring out how the pandemic began is fading among researchers as the virus fades in Europe. People are not interested, he told the Wall Street Journal. Despite the potentially dampening enthusiasm, research continues into the source of COVID-19. Last week, a group of scientists who rejected the theory that the virus leaked from a Wuhan laboratory doubled down on their claim in a letter. The International Coalition of Experts said there was still no scientifically validated evidence to support the so-called lab leak theory. Signatories include Dr. Peter Daszak, the British president of EcoHealth Alliance, which funneled money into research at the Wuhan Institute of Virology, and UK government scientific advisor Sir Jeremy Farrar. The letter, published in The Lancet, followed a piece in the same journal last February, which stated that the lab leak theory created fear and prejudice. It has been heavily criticized in recent weeks after it emerged that at least one of the signatories had undisclosed financial ties to the Wuhan lab. "24 of the scientists who signed last year's letter have also put their name to the new edition, which said allegations are of no help and that the strongest clue about the origin of the virus points to it evolving in nature." But 3 did not appear on the recent update, including Professor Peter Palazzi, who previously told Mail Online a lot of disturbing information had surfaced since the letter and he wanted to see answers covering all questions. The mainstream school of thought is that the coronavirus first emerged in bats and jumped to a host species before finally being passed to humans. However, some believe the virus leaked from the Wuhan Institute of Virology, which denies this. Advertisement.